Ultrasound for fetal behavioral and structural abnormalities in the first trimester. The definition of behavior, the fetal behavior, is that the fetal behavior can be defined as any observable action or reaction to an external stimulus by the fetus. Behavior is the interaction of an organism with its environment. So the environments of fetus are the surroundings, placenta, amniotic fluid, and some of the maternal body parts. If we look at the behavior according to the weeks, the sideway bending of the fetus can be observed at about 8 weeks, 7 to 8 weeks. General movement, startle, both they start at about 8 weeks. The earliest time is 8 weeks. Hiccup starts at 9 weeks. Breathing movements, they start at 10 weeks. Stretching of the body at 10 weeks. Yawning at 11 weeks. Isolated arm movement at 9 weeks. So all the ultrasonologists, they need to know these earliest times when the fetus will have such a behavior, so that once scanning we can observe the fetal movements and all these behaviors. It is not essential to have a 3D or 4D to find the yawning or bending or movements or breathing. We can easily see that on grayscale. So leg and arm isolated movements will be visible at 9 weeks. Hand-face contact at 10 weeks. Jaw opening at 10 weeks. Sucking and swallowing at 9 weeks. Head retroflexion at 9 weeks. Head rotation on the sides at 10 weeks, and head anteflexion, which is at 10 weeks. These are that movements which are seen in the first trimester. The leg will be moved. Both leg movement can be seen, which is the startle. Isolated arm movement, arm will be moved like this, isolated leg movement. And we have the head retroflexion. Then is yawning, extension, head anteflexion, forward movement. Here it was in the back side, and head rotation, moving head on different sides. High risk population will show some of the important things. Family history of neuromuscular skeletal disorders, which will delay all these movements. So there will be delay in the behavioral changes if there is family history of neuromuscular skeletal disorders. For instance, if we have a father with hereditary myopathy, the fetus can show some delay in these neuromuscular behavioral signs. Instead of journal movement, or especially the isolated arm movements, we can find the movement to be there at about 11 weeks instead of 9 weeks or 10 weeks. So we can find a delay of 2 weeks in such fetuses,